Hey guys, welcome back. And today we are going to discuss about other nursing diagnosis and care plans. So, our nursing diagnosis is about constipation. So, chronic dysfunctional constipation. So, we will see how to formulate or develop the nursing diagnosis first. So, before that, we will see what is constipation. Chronic dysfunctional constipation is a common issue characterized by infrequent bowel movement, difficulty in passing stools, and discomfort. Okay, and using NANDA nursing diagnosis format, how we will create the nursing diagnosis, that we will see first. So while writing the nursing diagnosis in this NANDA nursing format, okay, so how you will start, you will start the problem first, then you have to add the word related to, then you have to write the etiology, then you have to add the word as evidenced by, then you have to write the symptoms, okay, or the characteristic features. So we will see how to write the nursing diagnosis. So our problem is constipation, right? So that we can write like this: constipation related to decreased fluid intake and less dietary fibers, as evidenced by hard stools, abdominal discomfort, and infrequent bowel movements. Constipation related to decreased fluid intake and less dietary fiber, as evidenced by, related to, as evidenced by. Okay, the two words you have to add compulsory: by hard stools, abdominal discomfort, and infrequent bowel movement. Another nursing diagnosis: constipation related to sedentary lifestyle and medication use, as evidenced by reduced frequency of bowel movements, strain during bowel elimination, and abdominal distension. Okay, and in the context of post-surgical recovery, I mean, like after surgery, definitely the patient will face constipation. So in that case, how we will write the nursing diagnosis: constipation related to less physical activity and inadequate fluid intake, as evidenced by infrequent bowel movement and abdominal discomfort. Okay, in the context of stress, definitely stress can lead to constipation. So in the context of stress, you can write constipation related to stress and anxiety, as evidenced by infrequent bowel movements and abdominal discomfort, and also changes in the stool consistency. So any nursing diagnosis you can use depend upon the condition of your patient. Now we will see the care plan. So as I said in the previous nursing care plans, here also the same format. While writing, you have to add all these columns: assessment, diagnosis, planning, rational, implementation, and evaluation. So assessment, planning, diagnosis, okay, assessment, diagnosis, planning, rational, implementation, evaluation. Assessment, diagnosis, planning, rational, implementation, and evaluation. So all these columns are compulsory. So in assessment, two things we will write. What are all the two things? Subjective data and objective data. Subjective data means what the patient says about their condition, that is subjective data. And objective data means, as a nurse or a doctor or a healthcare professional, what you have observed from the condition of the patient, that is objective data. So here the subjective data is, the patient says that he is having difficulty in evacuation of feces and discomfort. Okay, so that is his complaints. Then what is objective data? The patient looks dull and tired, and evidence of bloating and decreased bowel sound. That is the objective data which you have observed from the patient. Now we'll write the nursing diagnosis. Any nursing diagnosis you can write depend upon the condition of your patient. Okay, I've written here like this: constipation related to decreased fluid intake and less dietary fiber, as evidenced by hard stools, abdominal discomfort, and infrequent bowel movement. So I've taken the first nursing diagnosis. Okay, you can take depend upon the condition of your patient. Okay, then what is the goal? The patient will report reduced discomfort. The patient will maintain regular bowel movements and regular lifestyle habits. Okay, so that is the goal. The patient will report reduced discomfort and the patient will maintain regular bowel movements and lifestyle habits. That is the diagnosis. Sorry, that is the goal. Now we will see the planning. Okay, in planning, what you have to write: what plans you are doing for the patient to overcome the specific situation, right? So in planning, always write in the present tense. Okay, and rational always start with to, and implementation always do in past tense. Okay, so first planning is always history collection, physical examination. So you can write do history collection and physical examination. For what? In rational, to understand the general condition of the patient. In implementation, done history collection and physical examination and recorded it. Okay. The second, planning: encourage a patient to take a high fiber diet. Encourage the patient to take a high fiber diet. For what? To increase the metabolism. Okay, and in implementation you can write encouraged the patient to take fruits and vegetables. Third planning, recommend an increase in fluid intake. Recommend the patient to take more amount of fluid. What is the rationale? To improve the digestion. In implementation you can write recommended and encourage the patient to take at least 8 glasses of water. So in implementation, basically you have to write the proof. Okay, if you add the proof, that would be really good, then the credibility of your care plan will increase. Okay, then next planning, regularly assess the bowel movement and the patterns of stool consistency. Regularly assess the bowel movement and patterns of stool consistency, and also you can check the patient's comfort and discomfort. For what? What is the rationale? To understand the reason of discomfort, to understand the reason of bowel imbalance, or to understand the reason for this discomfort of bowel. In implementation, assessed the bowel movement regularly and recorded it. So like that you have to write the planning. Now we'll see some more planning. Monitor the patient for signs of dehydration. Monitor the patient for signs of dehydration. For what? What is the rationale? To know the water and electrolyte balance in the body. Then what is the implementation? Monitored and reported to the physician. Then what is the next planning? Teach the side effect of certain medications and their impact on bowel function. Some medication can leads to constipation. So teach the side effects of certain medications and their impact on bowel function. Okay. What is the rationale? To avoid the excessive use of medication without doctors or pharmacist guidance. Then what is the implementation? Taught or educated and explain explain regarding the side effect with the help of a short video. Okay. Then next planning, assess the stress level and mood changes in the patient. Okay. For what? To reduce the impact of psychological factors. Assess and explain about stress management technique. Sometimes stress can lead to constipation, so you can advise some stress management techniques. So when the patient gets relaxed, automatically the metabolism and body processing will take place in the normal way. Then collaborate with dietitian for dietary plans. That's very, very important. For what? To improve the health and eating habit of the patient. Discussed with the dietitian, collaborated with the dietitian, and started simple diet plans for the patient based on the likes and dislikes of the patient. Then refer the patient to physical therapy if mobility is an issue. Okay, that is depend upon the condition of the patient. Okay, so refer the patient to the physical therapy if mobility is an issue. For what? To improve the physical activity. Referred the patient and started session with the therapist. Then last one, administer medication as per the doctor's order. For what? To reduce the symptoms of constipations, and administered medication. And specifically you can mention the medication if something is there in the case sheet or in front of you. You have administered some medications that you can write in the implementation. So after writing all these things, what you have to write? You have to write the evaluation. Evaluation always will be in the past tense. The patient reported reduced discomfort. Okay, and also the patient regained regular bowel movements and regular lifestyle habits. So in this way you have to write your nursing diagnosis and care plan for chronic dysfunctional bowel movement or chronic dysfunctional constipation. Okay, so I've given some nursing diagnosis. You can use the nursing diagnosis depend upon the condition of the patient. Okay, for surgery patient or post surgery, the reason is lack of physical activity might be the reason, or in some cases excessive use of medication might be the reason of constipation. In some cases lack of proper intake of fiber rich food. So depend upon the condition of your patient, you have to write the nursing diagnosis, and the care plans will be almost same for all condition, and that too depend upon the condition you have to categorize and write. That's it. Okay, so this is the nursing diagnosis and care plan based on NANDA nursing diagnosis for constipation. Hope you understand, guys, and next time we will see another nursing diagnosis and care plan. Thank you.